diagnose and treat a pediatric patient named Corey Micciolo?
Yes, I did.
And before coming to court today, did you review certain materials?
Yes.
And did you review the medical records from when you treated Corey?
Yes.
And did you also review the blood work for when you treated Corey?
Yes, I did.
And did you also review a bone survey that was done when you treated Corey?
Yes, I did.
Permission to approach?
Yes,
Your Honor?
sure, go ahead.
Mario, any objection?
To approach her?
Well,
That's up to the judge.
No, I'm showing you the documents.
No.
Okay, thank you. Okay. I'm now going to show you what's been marked S114.
Okay.
And can you tell us what that is?
This is what we call skeletal survey.
Okay, and without explaining that, would that help to assist your testimony today?
Yes, it does.
Okay, and I'm now showing you what's been marked S113. And can you tell us what that is?
This is a blood test.
And would that help to assist your testimony today?
Yes, it does.
And I'm now showing you what's been marked S44. And can you tell us what that is?
This is my chart.
And would that help to assist your testimony today?
Yes.
Okay, thank you, Doctor. Now, Corey arrived at the emergency room at approximately 8:34 p.m. on April 1st of 2021.
Yes.
And did Corey enter or was admitted into the emergency room at about 9:55?
Objection escalating.
What time was Corey admitted into the emergency room for observation?
About 9 p.m.
Okay. And when Corey arrived at the emergency room, who brought Corey to the emergency room?
His mother.
And what was the chief complaint when Corey arrived?
Patient has some bruises all over the body. They want to find out where those bruises come from.
Okay. And when Corey was admitted into the emergency room, did you obtain the patient's history from his mother?
Yes.
Did you observe Corey?
Yes, I did.
And can you tell the jury what Corey's demeanor was when you observed him?
He was very scary, little bit scary boy, and he afraid to answer my questions.
Objection. The phrasing.
Of what, the question?
It's not descriptive. He's assuming what Corey felt.
It's overruled. The doctor answered the question. Go ahead, Ms. Lumpkin.
Thank you, Judge. Was there also a resident who was working that evening with you at the hospital?
Yes.
And can you explain to the jurors what a resident is?
Resident is they are under the training to be a physician, full-fledged physician, so they have to go through with 3 years training. She is the general pediatric resident, so she usually come to emergency room, see the case, present the case, we discuss the case, and then we evaluate her, how good she is, whether she's going to pass the ER rotation or not. That is our job. Is.
And on April 1st, what was the resident's name who was assisting you?
Her name is Jennifer Szila.
And did you conduct a physical examination of Corey while at the emergency room at Jersey Shore?
Yes, I did.
And can you explain to the jurors what you did to examine Corey?
Okay. After the resident presented the case to me, I went to ask that question again. I went to ask both patient and mother do the examinations, and I discussed the mother what will be our plan for next 2 to 3 hours. And then I told the mother I will come and talk to you once all the lab results and imaging reports are in.
And how did you conduct the examination, meaning what did you do physically regarding the examination?
I did from head to toe examination, and then we marked down all the bruises, scratches in the diagram. I put everything in my chart.
Now, how were Corey's vital signs?
His vital signs are stable, and I'm not concerned when he arrived because of the vital signs are stable.
And can you tell the jurors about Corey's general constitution when you observed and treated him at Jersey Shore?
He's a small little boy. When I ask a question, he's scared. And
Doctor, I'm going to stop you there because you can only testify basically to what you did rather than what persons are saying. So can you just describe to us his constitution, meaning physically what you saw?
okay, physically, and we usually do head to toe examination, we go with system by system. So head to toe examination, we saw some bruises on the head, some bruises on the body, and some bruises on the back and legs. And neurologically, we do the cranial nerve examination, basically neurologically intact. He has no neurological deficit. He is active, alert, and not in distress. And any signs of failure, and chest examination within the normal limit. I did not hear any respiratory distress, wheezing, murmurs, hypoxia. He has nothing. And bar abdominal examination, abdomen is soft, no signs of acute abdomen. That means no tenderness, no pain, and no hard inconsistency by palpations. And physical general examination within the normal limit. All 4 limbs examinations, motor is intact, sensory is intact, saw only bruises, scratches. Other than that, we did not see anything.
So, doctor, all of your findings during this physical examination were normal?
Yes,
Okay.
except some bruises and scratches.
And what about Corey's lungs?
His lungs is clear, and as I mentioned before, no wheezing, no respiratory distress, no fast breathing, no hypoxia, and lungs is moving equally.
And you said that you had observed bruising.
Right.
And did the resident who you were working with document the bruising that she observed?
Yes.
And was this placed in the medical records?
Okay, let me take a look at it. We marked down all over the body, and we saw like some bruises, abrasion. The most significant one is on the chest bone area, like about 5 by 5 centimeter bruise. And the rest of them are small minor scratch and bruises on the head, anterior chest wall, and legs.
So did you observe any scratches on Corey's body?
Yes, I saw some scratches.
And did you observe any abrasions on Corey's body?
Yes, I saw some abrasion.
Now, calling your attention to the abrasion, specifically marked as 2, can you tell the jurors where this abrasion was located on Corey's body?
Abrasion is on the left temple area, 1 abrasion, and another one on the right knee area,
And specifically, in regard to bruise number 3, can you tell the jurors where that bruise was located?
Yes, as I mentioned before, this is in the mid-sternum area. Size is like about 5 by 5 centimeter circular.
And can you tell the jurors about bruise number 4, which was located?
Bruise number 4 is on the left side of the abdominal area. We call it flex area.
And what about bruise number 5?
Bruise number 5 is at the left arm area.
And what about bruise number 6?
Bruise number 6 on the left elbow area.
And what about number 7? Can you describe that for the jurors?
Bruise number 7 is on the left, the extensor aspect of the left hand area around the wrist.
And what about bruise number 8? Can you tell the jurors where that was located?
Bruise number 8 is on the right side of the posterior aspect of the arm area.
And what about abrasion number 9? Can you tell the jurors where that was located?
Abrasion number 9 is on the right knee area.
And what about bruise number 10? Where was that located?
On the right legs below the knee joint area.
And what about scratch number 11? Where was that located?
It's on the left legs below the knee joint area.
And what about bruise number 12? Where was that located?
Bruise number 12 is on the right temple area.
Now, doctor, can you tell the jurors what your impression was regarding the bruising that you observed to Corey's body on April 1st when you had observed him in the emergency room?
Right. I saw like a multiple ecchymosis.
Let me just stop you there. What's ecchymosis mean?
Ecchymosis means there is some bleeding underneath of the skin for like a few hours to a few days.
And what other impressions did you have regarding the bruising?
Those bruises are in various stages, as I mentioned before. Some of them are maybe hours, some of them are maybe days. I cannot tell you exactly more than that.
Doctor, when Corey was at Jersey Shore, did you order blood work?
Yes, I did.
And was Corey's blood collected on April 1st, 2021 at approximately 10:49 that evening?
That exactly.